Today's question for Dr. Amy Louis-Bayliss is, which supplements are best for me to prioritize and for what?
So my caveat, I'm going to discuss a few supplements with you, but my caveat to this is twofold. One is we have to remember that the supplement is $1 billion industry, that supplements are $1 billion industry, and that most supplements overpromise on what they can do. Number two is that supplements are not regulated or tested in the same regards as other Health Canada approved medications. And so we often don't know if what is being delivered in a supplement is actually in fact true. And there's multiple studies that have questioned validity of what's on supplement labels. However, there are a few supplements that I recommend, but this is usually in the context of being able to test the level in the blood and then being able to test that there's been improvement because a supplement was taken. So for example, vitamin D. Vitamin D is a nutrient that is very, very hard for you to get from sun exposure if you live in North America or from your diet. And most women are vitamin D deficient. So I think most women need to be on a vitamin D supplement, and most women require somewhere around 800 to 1,000 international units of vitamin D a day. So there are a couple of brands that have performed better than others. However, the best way to know whether or not the vitamin D you're consuming is working is you can have your vitamin D level tested. Now, you have to pay for this in Ontario, but I do think it's worth assuming that you're vitamin D deficient, starting a vitamin D supplement, and then having your vitamin D levels checked once you've started a supplement to make sure that what you're taking is adequate, because then you know how much you should maybe go up or go down, or I can make an educated guess with your healthcare provider. A lot of women have very, very, very heavy periods through early perimenopause. That's actually a key component of early perimenopause. And they can become very iron deficient. So I do think ferritin testing, especially if you've had those really heavy periods, is necessary. Low ferritin can make you feel terrible. It also causes your hair to fall out. And I do think, once again, if that ferritin level comes back low, we would recommend an iron supplement, but we would recheck the ferritin to make sure that that supplement was working. Okay. Calcium, if you are at high risk for osteoporosis, you should be getting your calcium from your diet. Dietary calcium is better than a calcium supplement. If you go to Osteoporosis Canada, you can actually plug in your daily nutrition and you can see whether or not you're meeting your calcium needs. If you are not meeting your calcium needs, I would challenge you to eat more calcium nutritionally, and that would be through dairy, like dairy products, through proteins, through some vegetables. And if not, then a calcium supplement may be required. And once again, the goal is around 1,200 milligrams of calcium a day. Creatine is actually a super interesting supplement that is starting to get a lot of attention. So creatine monohydrate has been studied in postmenopausal women, specifically looking at preservation of muscle mass, preservation of bone mass, and they're actually starting to look at cognition. And it's looking quite promising. The dosing that they're using is 5 grams every day, and creatine can cause some bloating, so you might actually need to divide the dose, so 2.5 in the morning, 2.5 in the afternoon. It's a powder that you can put in a smoothie. You can also get creatine from like natural protein sources like beef or chicken. You just have to consume quite a bit of it. But the caveat with creatine is when they've looked at studies, they've looked at women who were exercising and lifting weights. So they had put some sort of stress on their system for that muscle protein synthesis to require, so actual muscle repair and muscle build. And those are the women that really benefited from the muscle mass and the bone mass. So if you're not exercising regularly, you are not weightlifting, then this is probably a supplement you could save your money on. There is some good evidence for magnesium biglycinate as a supplement to aid with sleep, but it doesn't help everyone. The dose is somewhere around 200 milligrams. If you're having trouble with sleeping, it's safe. You could probably try it if you really wanted to, but the caveat is it doesn't work for everyone, and most people that start magnesium get a benefit for the first few months, and then the benefit kind of eases off. B12 can cause anemia for women, and once again, B12 levels should be checked, and if you're B12 deficient, then we would replace it. So those are, I think, the main supplements that I think should be considered.
This has been a LUME Minute. a collaboration between This is Perimenopause and LUME Women's Health. Have questions that you want answered? Drop us a note in the comments or send us an email to hello@thisisperimenopause.com. Please note this information is not intended as medical advice. The intent of this information is to provide our listeners with knowledge to support more efficient and effective communication with their medical providers.